Assalamu alaikum wa rahmatullah. The article of this week is titled "A Dental Dedicated MRI in the Assessment of Pulp Vitality and Apical Periodontitis, a Visibility Study." It was done by a group from Denmark and published in the International Endodontic Journal in 2026. So the clinical sensitivity tests are indirect and prone to inaccuracies due to the subjectivity. However, the dental dedicated MRI has recently emerged as a novel imaging modality, enabling non-invasive ionizing radiation-free visualization of the hard and soft tissues in the maxillofacial region. Also, it's basically different from the well-known medical MRI as it operates with a low field strength, a dedicated radiofrequency coil, and tailored pulse sequences. So it's designed to fit the diagnostic tasks that are relevant in dentistry. However, limited information is available about the diagnostic accuracy of this MRI in the assessment of pulp vitality and the diagnosis of apical periodontitis. To address the limited evidence of this topic, this feasibility study explores the utility of this MRI in evaluating pulp vitality and diagnosing apical periodontitis by assessing the diagnostic accuracy of dental dedicated MRI in those two diagnostic tasks as an adjunct to clinical assessment and radiographic imaging. For their materials and methods, 10 patients were consecutively chosen with 18 teeth, and patients were included when they had a recent CBCT examination, at least one tooth with suspected apical periodontitis or uncertain diagnosis, and ability to undergo MRI examination. And also they were excluded if they have pregnancy, insulin pumps, pacemakers, large tattoos, and also non-removable metallic piercings. Then the pulpal and periapical status was determined using patient history, clinical examination, palpation, percussion, cold test, EPT, periapical radiographs, and CBCT. The clinical examiner categorized the teeth into groups: vital pulp with healthy periapical tissue, necrotic pulp with or without apical periodontitis, root canal treated teeth with or without apical periodontitis. The apical periodontitis was suspected when there were symptoms such as pain, tenderness to palpation and percussion, sinus tract, or radiographic radiolucency. Then the CBCT volumes were assessed by 3 experienced oral radiology observers. They evaluated the presence or absence of apical periodontitis using radiographic signs, mainly the periapical radiolucency. For the dental dedicated MRI, each tooth was scanned, and the protocol included 6 pulse sequences optimized for periapical diagnosis, and a total scanning time was approximately 18 minutes per tooth. The same 3 observers assessed the dental dedicated MRI, and they evaluated the visibility of anatomical structures, pulp vitality, presence of apical periodontitis, and an overall diagnostic image quality. The vital pulp was diagnosed on the MRI if there was a presence of signal from the pulp, and it was diagnosed as necrotic pulp if there was an absence of signal from the pulp. And for the apical periodontitis, it was detected by the presence of the edema or fluid accumulation in the periapical tissues, seen as hyper-intense signal. Moving on to the results, all anatomical structures were visible on the dental dedicated MRI in all included cases, and it showed good image quality overall, and it was considered as suitable for diagnostic assessment. For the bulb vitality, it showed sensitivity of 75% and specificity of 91% and accuracy of 88%. For the apical periodontitis, it showed sensitivity of 100% and 92% specificity and an accuracy of 94%. The agreement between the clinical assessment and the MRI: for the pulp vitality, it was 88%, and for the apical periodontitis, it was 94.5%. And for the agreement between the CBCT and the MRI for apical periodontitis, it was 94%. Also, it detected the apical periodontitis in all apical periodontitis cases included in the study. In conclusion, The dental dedicated MRI show promising results as a non-ionizing imaging modality for assessment of pulp vitality and diagnosis of apical periodontitis. This visibility study demonstrates the potential of this MRI to provide accurate diagnostic support, laying a foundation for larger scale validation studies and clinical applications. However, in my opinion, the study has many limitations, such as the small sample size, so the findings can't be generalized. Also, it's a visibility study only. The study mainly tested whether we can use it, not to if it's ready for the routine clinical use. Also, a few diseased cases were included, so the accuracy may be overestimated. Also, the lung scanning time, which is 18 minutes, it may not be practical in daily clinical practice. And also, the MRI, it's not widely available and it might be expensive compared with the conventional imaging.